Welcome, everyone, to the Back on Track Healthy Living podcast. This is episode 1, and we're just trying some things out. Things might change as we go, but we're just going to get started here and move on along. So, my name is Cameron Dennis. I'm a physical therapist. I've got my doctorate at the University of Toledo in 2015, and my undergrad in exercise science in 2012. I'm from Wapakoneta, Ohio. Actually, I'm from Anna originally, but now I live in Wapak. Um, so don't ask anyone to spell it, but yeah, Wapakoneta. And I have a physical therapy practice in Shawnee or Lima, Ohio, Back on Track Therapy and Wellness, which we've had for, I don't know, since 2017. It's had a couple different iterations, but we are rolling now. We've got 4 physical therapists and a physical therapy assistant, as well as a full administrative staff. And we see a lot of active people. So the main focus of this podcast is to help educate and to learn more myself about the types of things that are going on in the world of health and fitness and wellness. But it's not necessarily something that's going to be restricted just to physical therapy topics or just to exercise topics, but I want to explore other topics such as medications, sleep, nutrition, mental health, overall wellness. So if you're worried that it's just going to be a physical therapy podcast, don't worry. We're going to get into a lot of different topics. We're going to have some cool people on to interview. We're going to have some doctors, chiropractors, some massage therapists, some gym owners, some other physical therapists, occupational therapists. Maybe we'll get into some pharmacists, things like that. But nobody knows everything. I don't know everything. I can tell you that. My wife can tell you that. And I want to learn as much as possible, right? I want to get the word out there. I want to help educate the public and have fun doing it. So let's start today just by kind of talking a little bit about the importance of getting a good night's sleep and managing your stress and eating well and getting regular exercise. So those are the main pillars of health and wellness as I see it. Um, let's look at one at a time. We're not going to go into a deep dive of this just now, but I wanted to at least talk about the importance of them, and so that you can sort of at least know my perspective, right? So what we do in physical therapy is we help people who are dealing with either chronic injuries, chronic pain, um, you name it, back pain, knee pain, hip pain, whatever pain. These are people that have had surgery. There's people that have not had surgery, all sorts of people coming in here, right? But we're all dealing with similar things, right? We're all busy. We're all, uh, we all have more going on underneath the surface than what people really recognize, I think. And I think it's important that when you see a patient as a healthcare provider, that you understand that you're only seeing them for a very short period of time, and you're not getting the entire picture. And sometimes people, not unintentionally, won't you won't see their whole picture, because really, unless you follow them around, for the entire day, which I'm not sure you want any of your docs doing that, but they're not going to get the whole picture, right? And so they're doing their best to get um, as much information as they can. And that, what if you go to your family doctor, 10-20 minute video, 10 to 20 minute session. Physical therapy might be an hour. You get the idea, but it's a short period of time, right? And so um, they're not going to see the whole picture, right? And so we have to take uh, responsibility for our own health in a lot of ways. And the problem is there's so much misinformation out there that I think it's important for healthcare providers to go out of their way to help educate the people who may not have a good understanding of what they're seeing on social media or what they're seeing even on the news. Because just because you see it on the news doesn't mean it's true, right? They may be reporting that a certain article found something or a certain study found something, but they don't necessarily delve into the quality of that study. They don't go into the importance of that study or the repercussions of that study. They're basically trying to get your attention, right? They want to see you click. They want to see your eyeballs stay on that screen, through the commercial breaks and things like that. So they're going to say things that are going to get you hyped and amped up. But that's not necessarily giving you a good idea for what the information truly is, or, maybe it's a misrepresentation of the actual information. And so we're going to just explore. Let's talk about sleep a little bit. The impact of sleep on your physical well-being, as I see it as a physical therapist. Um, so I can usually tell when there's something going on with folks that come in, they're doing the exercise, they're getting the manual therapy, the massage, they're getting the stretches, whatever it is that we're doing with them that day. We're educating on, try and do these things more throughout the day, try and, sit in the same position a little bit less throughout the day. All of these different things, right? Um, we're doing all of them, but they're not getting better. We expect them to get better because we've seen the same type of patients get better time and time again. Why is this one person not getting better? Well, there's something that we're not seeing, right? Everyone is different. And our one thing that we will do, at least in physical therapy, and your family doctors will do this, your chiropractors hopefully are doing this, many are, is to start asking you questions about how much sleep are you getting? Are you getting 6 to 8 hours of sleep? If you are working more of a physical job, are you getting even more than that? You might, they make these general recommendations for getting 6 hours of sleep for an adult. Well, that may not be enough. If you are someone who's stressed out a lot, if you're someone who's working a very physical job, that 6 hours is not enough. And depending on the situation, 8 hours might not be enough. And so you have to sort of play around with that yourself. The biggest thing that I find is that it comes down to lack of rest and poor nutrition. Sometimes it comes down to stress and stress management, but that's something that you just have to kind of talk to, determine as you're talking to the patient, pick up, is this someone who seems to be high strung, you know, and kind of dig into that a little bit. But I guess the biggest thing is, uh, like I said, I'm not going to go into these in too much depth today, but I wanted to say that because your doctor, your family doctor, your chiropractor, your physical therapist don't only have so much time, right? They have so many patients to see. You have to start taking accountability for your own life and in these areas, um, particularly sleep, nutrition, um, stress management, and daily, or when we say daily activity, when I say regular exercise is what I'm really referring to. And when I'm referring to regular exercise, some people think that means you have to go and bust your butt in the gym 7 days a week. It's not what I'm saying. I think most adults should have 30 minutes of moderate level intensity activity most days of the week, more than half days of the week. So 3 to 4 days of the week, if I want to be more specific. That can be very helpful um, in terms of helping with your ability to handle more like the daily loads of daily life. So picking up your kids, your grandkids, picking up heavy box. Say one day you know, you're, say you're a dad or you're a male. Well, females do this kind of thing too, housework in terms of, I don't know, say I had to do some insulation. That was very physically demanding. It was blown in, but man, it was a lot. But if I hadn't been physically active, that would have been something that would have put me down for a long time. I mean, I would have been very sore, but potentially injured after doing something that's extremely physically demanding. Um, so doing this daily exercise, or when I say daily, uh, multiple times throughout the week, exercise is going to help your body be more well prepared for those types of things and keep you from having blown out discs, we'll call it, more like back issues, disc herniations, things like that, rotator cuff tears, all of these things that you hear about, that all of your friends have, your parents had, those are not ever 100% preventable. However, you can definitely reduce the risk of them happening to you. And if they do happen to you, if you're more active, you're addressing these pillars of health, it's going to significantly reduce the amount of time it takes for you to get back to where you want to be once that's done. So anyway, this has just been a brief sort of overview. There's so much that we can go in depth, but I really just wanted this to be a quick introduction. That's the kind of things we're going to talk about. Um, so once again, my name is Cameron Dennis. I'm a doctor of physical therapy. We're going to be doing some interviews on here. We're going to be going into some deep topics in outside of physical therapy as well. Of course, I'll have sort of my own bias just from looking at it through that lens, but I'm hoping to get more perspectives from others in the field as well. So I'd love to hear from you if you are feel inclined, you can always send us a message. You can email me at cameron@backontracktherapy.com. Send me an email. You can request topics that we can talk about on here. You can give me feedback. Hopefully it's positive. If you have negative feedback, as long as it's constructive, I'll take that. But if you're going to be a jerk, you can leave it to yourself. I know people can be online, but anyway, hopefully this is going to be a nice positive experience for everyone. We're going to learn a lot, have some fun, and yeah. So hope to talk to you guys soon. Take care.